18-year-old teenager with knee pain, history, and physical.
Ah, history and
Hurts so
physical.
bad. Yeah, that's good.
Hello.
Hi.
Registration.
There.
Oh, I should see it. Okay. Hello.
Hi.
Is it Mr. Smith?
Yeah,
I'm Dr. Gurnath, and I'm one of the physicians who's working here
you
today.
can call me
Louder,
Johnny.
please, louder.
Johnny?
Johnny is fine,
Johnny,
yeah.
okay, thank you.
Registration.
All right, Johnny, I understand you're here because you've had pain in your knee for about 2 hours.
Yeah,
Is that right?
yeah.
Okay, can you tell me a bit about it?
Yeah, I was playing soccer with my friends,
Okay.
and I have this like stupid friend who just ran and kicked me to my knee,
Oh,
and now it hurts.
okay. So
Yeah.
kick to the knee.
Yeah,
Okay. And I just need to ask you a bit more about the pain, if that's okay.
okay, okay.
So I see that you're holding your right knee. Are you able to point to a specific place where it hurts?
It hurts right there.
On the side there?
Yeah,
Okay. All right. And can you describe the pain to me?
it's just achy.
Achy?
Yeah, it's like maybe you can give me like some meds.
Okay, yeah, I will try to get to that. So over the next few minutes, I'm just going to be asking you some more questions.
Okay,
And we'll also have to move the knee as much as you're comfortable with and
Okay.
do an exam. And then we can see about getting you some pain medication if you can pull
okay,
it out.
okay.
Okay?
Yeah,
All right. Fine. Are you comfortable sitting that way, by the way?
I'm good. Yeah.
Okay, and since it started, has the pain been getting worse, better, or stayed the same?
I think it's the same, it just hurts, yeah.
It hurts, okay. All right, I am sorry to hear that, by the way, that you're in pain. And then, so you said it's like an ache. Does the pain go anywhere else? Like
No,
shoot?
it's just here and, yeah.
Okay, and this is a bit of a strange question, I appreciate that. So if you had to rate the pain out of 10, with 10 being the worst possible pain you can imagine, and 0 being no pain, where would it
I
fall?
think it's an 8.
An 8?
Yeah.
Okay, that sounds quite severe. Seems
Mhm.
very difficult.
That's why I want something for pain.
There, okay, I'll be as swift as I can.
Thank you, doctor, thank you.
All right, fine, and then, does anything make the pain worse?
Yeah, moving, like, it's hard to walk.
To walk, okay.
Yeah.
Any specific movements make it especially worse?
Just like walking, my friends had to actually carry me here.
Oh, I see, okay.
Yeah.
Can you put any weight on it at all?
I can, but it just hurts,
It hurts
you know.
too much, okay, that's
But I
good.
have some good friends too, so they helped me to get here.
That's okay.
Louder,
Okay,
please.
does anything make the pain better?
Just not moving.
Fair enough. Have you tried anything like Tylenol?
No,
Anything like that?
no, I don't do drugs.
Okay, all right. But you are okay with pain medication?
Well, it hurts, it hurts.
Okay, necessitates. Okay, all right. Okay, because this is the first time I'm meeting you, I just need to ask you some more questions about your general health.
Okay.
Have you ever had episodes of pain in the knees in the past?
No,
Or any other joint?
no,
At this moment, does any other joint hurt?
no,
Okay. Do you have any other medical conditions at all?
no,
Any diabetes, for instance?
no diabetes.
Okay. Have you ever been in the hospital before? For anything?
No,
Or any surgeries in the past,
No.
particularly on that knee?
no,
Okay. Do you take any medications at all?
no,
No. Okay. Are you allergic to anything? Any medication?
no.
Okay. A little bit about your family history. Do any medical conditions run in your family?
Not that I'm aware of.
Okay. All right. And just a little bit about your lifestyle and things like
Okay.
that. Who do you live with at home?
That was my parents.
Your parents. Okay. And do you smoke at all?
No, I play sports.
Okay. And do you drink any alcohol?
No,
Okay. And have you ever done any recreational drugs? Okay. All right. So I just need to ask you whether it would be okay if I did a physical exam on you now.
as long as it helps my pain, I'm up for that.
Ideally, I would start with your good knee and then move to the bad one, but I think in the interest of time, we'll just speed things up.
Okay,
I
yeah.
am going to have to see how much you can walk from me. Is that
I
okay?
can't walk.
If I tried to give you some support, would you be able to stand for me, just holding the bed?
I can't walk. It just hurts so bad that I don't want to walk.
Okay, so I'm just going to have a look at your knees just as you are then,
Sure.
okay?
Imagine that this is the knee, because it's hard to
Okay.
move there.
Oh, thank you.
It's more exposed.
Okay, I'll pretend this is the
Do you
bad
want,
knee then.
do you want to just move it a little? You want to move it a little?
Yeah.
Just want to- And do your exam here. I know that's that, but do your exam on this
Okay,
thing.
looking.
Okay, okay.
Ideally, you'd want to have him stand so I could look at the valgus varus deformity, and gait would be especially useful to see if there's a specific kind of gait. Okay, would you be okay to recline
Sure.
for the rest of this? So I couldn't see any evidence of scarring, some redness maybe? No? No redness, look at the rest of seats, I'm just gonna move on.
Okay.
Okay, so I'm just gonna have a feel.
So
for the
seeds,
okay?
scar,
On the other
atrophy,
side.
swelling, erythema, deformity, scars in the past.
So ideally I'd like to be on the right side of the patient, but maybe we shall do this anyway. Okay, sympathy for
Nothing is
temperature.
clear.
So I apologize that my
Don't worry
hands are
about it.
cold. So temperature seems normal
Your
across
husband
both
is
legs.
safe.
And it's, let me know if there's any pain.
Okay.
Is that okay? So this is the bad knee now?
Mm-hmm.
Okay, can you bend this for me at all?
Sure.
Yeah. Okay, I'm just going to feel across the knee joint.
Oh.
There doesn't seem to be any point tenderness.
Can you see what she's doing?
Tibia properly, patellar tendon. I'm feeling the back. Doesn't seem to be a Baker's cyst. Okay. And now I'm just going to have to ask you to do a few movements, sir. Is that okay?
Okay.
I'm just going to put my hand over. Can you bend your leg as far back as it'll go?
It hurts.
Okay. And can you stretch?
Yeah.
Okay. So now I'm just going to try to do this for you. I will stop as soon as you say it's too much. Okay.
Okay.
So there's restrained active and passive flexion and extension, and I don't feel any practice. Okay, I'm just going to have to do some extra tests now. Just bend this just a touch more, and I'll be as gentle as I can. Is that okay? Okay, so it's a negative anterior drawer test. And posterior drawer test as well. I'm just going to lift your leg now. Let me know if that's okay.
Oh, it hurts. Oh my
Okay.
God.
Okay, I'm so sorry. I'm just going to try the other side.
Okay.
Is this all right?
Yeah, that doesn't hurt as bad as the
Does
before.
anything move inwards when you do this, or is it
You
just?
tell me.
It hurts.
Okay, all right, I'm done then. Thank you very much. I'm gonna just sanitize the hands. And then to complete my exam, I'd want to examine the other leg, the other knee, the joint above, so the hip and joint below the ankle as well. And yeah.
Any other comment, any other thing that you want to add?
I think the positive findings was pain when I tried to check for the lateral ligament.
Mm-hmm.
So I think there might be some soft tissue problem with the lateral ligament.
Then you have extra time, you still have extra time, you still have maybe 25 seconds, so you can use it efficiently if you want.
I'm just gonna run back and do check for fusion. Is that okay? Okay, doesn't seem to be any extra ligaments.
Orthopedic surgery, what did they tell you to check for any patient?
Sensory.
Reflex, right? The musculoskeletal thing, MSR, motor, sensory, and reflex. Motor, sensory, and reflex, check it. If you didn't, actually, it was fine. If it was your first time doing the knee exam, it was fine. You asked a lot of good questions. You were professional. You were really professional. The way that you were asking, I know English is not a big problem for you, so you didn't have the problem that a lot of our doctors have that in fluent English. So you were, the flow of your actually history taking was really natural. You were professional, you had empathy for the patient, but for example, if you had a patient which is not as athletic as Dr. Ivan is, it was really hard for you to do the examination. For example, if you had a tiny little girl, for example, doing examination on her, when you do like this for anterior draw and posterior draw test, you actually pull them toward you and they will sleep off the bed, or they will sleep at the other side of the bed. So when you are doing, you have to fix the knee, right? And the other thing, okay, the Dr. Ivan was a guy and he was wearing underwear, thank God, right? But for example, if you have a lady with a gown or something like that, and from the opposite gender or something like that, in case that just be, I'm not saying you didn't do anything wrong, you were not doing anything wrong. A little bit about draping, you could be more actually, because you had this, right? So you could actually cover the area of the underwear. No, that was okay. That wasn't a big deal. I had to cover it for the sake of the video broadcasting. So otherwise everything was fine, and your wife was really scared, was really not worried about you, so I had to cover it for you.
Yeah,
So-
okay.
So the other thing about it, that when you want to do the examination, of course the patient is in pain, right? So when you want to check the lateral ligaments or something like that, that is okay, but okay, just compare your actually size with his size, right? So you were doing like this. So you had your hand in like touching,
I completely
and then
forgot
I
to
know
do
that
it.
is okay. Get a good support, get a good grab up here, and then check and say, I will force a little bit. If you have pain, I will stop it. So if he can feel the grab, you can feel the grab, right?
Yeah.
So if you grab it like this and then try to move it a little bit toward inward, if he says ouch, you will stop. But you're supporting it, right? So you're not making it worse. But the way that you were doing it, compare your size with the patient. Right? The way that you were doing it, you were like this. So you were not having any support here. So you were just ow, 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 right? So because you didn't have any support. But if you have a good support and then move it a little bit, the patient says, ouch. The patient has tenderness in the medial aspect. The patient has tenderness in the lateral, or the patient doesn't have any tenderness. But I have a support. But okay, my position is not right. The position should be exactly here, right? But if I have a good support here, then I can do that. If I had a good support here, then I can move it a little bit, right? For anterior posterior drawer test, if you have a patient with this size and this athletic, so you have to put a support. I'm not saying sit completely on the patient, but you can have a support here, right? So and check it like this. Check it like this, or check it backward. So you're fixing the patient. You're fixing the way that you were doing it, you were doing like this, right?
Okay.
So the patient will move. How do you show, how? It's at the same time that you're acting, at the same time you should act naturally, right? It's like, for example, in the movies or something, in the movies or something like that, they act that they are shooting each other, but you have to do it naturally, right? So it's somehow acting, somehow performance. So you show that you are doing it right. You show that you are doing it right. So I'm fixing and then pushing it, right? I'm fixing and trying to see. A little bit, I'm not saying go all the way. Yeah, in the office, if I want to do examination on Dr. Yvonne, I will sit. Not that much, but I will sit. I'm much lighter than him. So if I do that, right, now it's the correct way. But in the exam, I don't want to do that. I don't want to risk it and sit on the patient actually damage him more. But I want to fix it, at least a little bit support here. You know, I'm not sitting on it, but I have a support here, right? So I'm showing that I'm doing it naturally and normally. Do you agree?
Yeah.
Any other comments from you?
I think that because of the nails, all the
Because of the nails?
yeah, the long
Yeah.
nails were
Ladies, the day that you were going for the exam, forget about the nail polish and forget about the artificial nails or if you have long nails. I would actually cut it. I would do that. That's my recommendation. I'm not saying it's 100%, it's something that they give you negative scores or something like that for. I cannot say that, to be honest with you. It really depends they like you or not. But I wouldn't do that, yes.
I think should you wear gloves?
Sorry?
Should you wear gloves? in certification?
Should you what?
wear gloves.
This has been
Wear gloves? Usually gloves are not there, but you have to sanitize your hand.
Unless if you have an active bleeding or something, then you need to. let
If
the
you have
examiner
active
know.
bleeding, that's a different story. When you have active bleeding, then you say, I want to have protection for myself and my team. By protection, I mean gowns, gloves, and goggles. That's usually QE2 case. That's usually QE2 case. I want to activate ACLS protocol or ATLS protocol if it is trauma, or ACLS protocol if it is GI bleeding or it's a cardiac life support. And I want protection if there is any chance of bleeding or something like that. I want protection for myself and my team. By protection, I mean gowns, gloves, and goggles. Yes.
I love how the doctor took everything the patient said at face value,
Uh-huh.
but I detected that there might be some untruthfulness to what he said, just because twice he asked that he would like some kind of pain depressant. He also rated that his knee was an 8 out of 10 pain and that he couldn't walk. However, when the physical examination was taking place and they were moving his leg, he only mentioned pain about twice. And actually when he said where the pain was, he hit his leg twice where it is. You would think that he would be gentle where his pain is. I'm actually surprised he didn't request morphine or some stronger pain medication. Although I don't know what's inside the patient, so I would send him to an X-ray.
So, of course, he needed
Yes.
an X-ray, so at the end of the station, if I ask you what is your diagnosis, the other thing, usually if you have a history physical, it's not drug seeking. Usually if it is history physical,
Yeah, it wasn't.
and the patient telling you the history of trauma or something like that, the whole story is not, they are not lying. If they are lying, usually it's a longer case, it's not 8 minutes. Actually, it's good that you have this much attention, fantastic, but usually drug-seeking patients usually it needs counseling, usually 9 to 10 minutes. When you have 4 and 4 to history and physical, they usually want to say which questions you are asking and which questions. About the other thing, about any trauma or something like that, ask about the ankle. What exactly happened? Did you hurt anywhere else? Is there any chance that you hit your head somewhere else? Did you lose your consciousness or not? And especially in any case of trauma ankle, ask about the mechanism of the injury, right? How did that happen? Was it a twisting movement? He said something, hit it. Okay, was it from the back? Was it from the front? It might be ACL, it might be PCL. Did you notice any locking, right? When it gets locked, usually it's meniscal tearing, right? When it's twisting, it might be meniscus as well. The direction of the hit will tell you, is it lateral, is it medial, is it anterior, is it posterior, is it both or not, right? And any trauma to anywhere, especially musculoskeletal, do not forget to check MSR, motor, sensory, and reflexes, right? Motor, sensory. Probably you couldn't check the knee reflex on this side, which he was in pain. So he said, because the patient is in agony and pain, I will skip this side for reflexes, but I will check the others. But you could check the sense. You could check the pulse, right? In any ankle reflex, you could check ankle reflex instead of the knee reflex, right?
Yeah.
Yes. So it's yes,
Go
you say?
ahead.
You use
No,
it?
yes.
She speaks a little too fast. It's very hard at some point for her to actually give some weight to the great words of information she gave. So at some point, she also says, a few times she said, I'll ask you about your social history and stuff like that, So this is not professional.
You said stuff like that?
Yeah,
I
she
didn't
said,
hear.
and stuff
Stuff?
like that. Ask you and
Don't
stuff
use
like
the
that.
stuff. I didn't notice, but maybe I wasn't paying attention as much, but I didn't notice that.
It's more like, each of us have like, you say or stuff like that, like that. So if you tape, you will correct this very easily because, I find that you are very good in the, in your knowledge and immediately you jump from one question to the other. At some point, twice or 3 times you stopped. You didn't know what the next thing is because everything else was so fast. Those gaps looked more okay, she doesn't know what she wants to do next. So just a little bit when you tape to be a little bit more, paced off. Like this, you'll hit a very high mark.
You saw the flow when you were taking the history.
Yeah.
You didn't have the same flow with examination, and that is okay. I know the background. I was doing the same thing when I was doing Nac OSCE, so I know where the problem is. You didn't have enough. You didn't do enough practice on physical examination, right? And so history, all of you guys are doing great.
And she
I know,
doesn't have,
okay?
she
And
doesn't
with
have
the-
practice.
With the physical, that's
Experience.
okay. With the physical, you need to practice physical. You have to have 4-minute version and 8-minute version of physical examination for all of this. Okay?
Now-
You're-
Can we ask between the two, which one, guys, do you give a higher
Oh,
mark?
don't do
Oh.
that.
No, we need to know, listen,
Why?
because we need to know how we can, help. So we will vote we'll give them marks.
We already know how we can improve.
It's not
But
about
also,
you, it's
can
about
I add
us.
also, because
Oh,
yeah.
I really like the introduction, it was really good. You did ample, okay, but you could also ask about last step
Last
shot.
meal, last
Last
that's
meal.
your shot,
Those
right?
things are important, and I don't think you're asking about constitutional symptoms,
Yeah.
because that was very important. But everything was, from history was good. Then this physical examination, don't forget to say, I'm going to wash my hands now and trace you. So
She
you
said
feel-
that, but she couldn't find it.
So I would feel more comfortable. Yeah.
She said.
And when you're doing physical examination, try to work on, when you're doing TTC, like temperature and tenderness.
Tenderness.
You asked me about where my pain was, right? But you only felt my knee here and at the back, and you didn't feel it on the sides. And because I got kicked in, and I had my medial collateral ligament was ruptured. And when you did the test, when you did the valgus stress test, in the end you said it was lateral, it was medial. And also, one more thing that I wanted to mention. Yes, when you're doing seeds, on the exam they will intentionally put some scratches or there will be some birthmarks. Please comment on that. Because like, I have a surgical scar here, not just a scar, and I intentionally picked this knee just to see if you're gonna say there is a scar. And that could be relevant to a trauma or surgery. So ask me, you didn't ask me about this scar. So on the exam, try to pay attention to things like scars, any birthmarks, or like patients sitting and coughing into the napkin, see if there's any blood in the napkin, stuff like small things, but always question those things.
With the history taking, I'm okay with the history taking 80%. With physical, no offense, but you need a lot of practice. With physical exam, you need to practice like most of us.
But overall,
But
she was
she
good.
said
She said that
I
about
saw
redness.
some
I noticed the
redness.
redness. Yes, I know. I'm not saying she was fine, but she needs practice on physical examination.
We all like need to practice some things and make it better, but it was good, so thank you guys.
Thank you so much.